Welcome to today's video about symptoms of gallbladder disease. Have you ever experienced unexplained shoulder pain that wouldn't go away? Or noticed your urine turning dark brown despite drinking plenty of water? These seemingly unrelated symptoms might be warning signs from an organ you rarely think about, your gallbladder. This small, pear-shaped organ, tucked beneath your liver, plays a critical role in digestion. Yet when it malfunctions, the warning signs can be surprisingly misleading. Many people dismiss these symptoms as unrelated health issues, never suspecting their gallbladder could be the root cause. Today, we're uncovering 13 strange symptoms of gallbladder disease that often fly under the radar. Some of these warning signs are so unexpected that even doctors say their patients completely overlooked them. Stay with us until the end because symptom number 11 is something that catches most people completely off guard. Let's dive in. Alright, let's jump straight into the symptoms of gallbladder disease, beginning with the first one: persistent right shoulder pain. Let's begin with one of the most confusing symptoms that puzzles both patients and doctors. Imagine experiencing persistent pain in your right shoulder or shoulder blade that has nothing to do with exercise or injury. This perplexing phenomenon occurs because your gallbladder and shoulder share nerve pathways through the phrenic nerve. Research published in medical literature confirms that gallbladder inflammation irritates the right phrenic nerve, which runs from your neck, through your chest, into your abdomen near the gallbladder. When this nerve becomes irritated by an inflamed gallbladder, it sends pain signals that your brain interprets as coming from your shoulder region, called referred pain. What makes this symptom particularly deceptive is that the pain typically feels muscular, leading many people to blame poor posture or sleeping positions. Studies have documented this referred shoulder pain pattern in patients with gallbladder disease, with pain often intensifying after eating fatty meals when your gallbladder contracts to release bile. If you've been treating persistent shoulder pain without relief, especially if it worsens after eating, your gallbladder might be trying to send you an important message requiring professional evaluation. Next, symptom 2, unexplained clay-colored stools. Here's something most people never think to monitor, yet it provides crucial diagnostic clues about gallbladder health. Your stool color might seem like an odd topic, but it reveals critical information about bile flow through your digestive system. Healthy stool gets its characteristic brown color from bile pigments processed through your digestive tract. When gallbladder disease blocks bile ducts, bile cannot reach your intestines properly, resulting in pale, clay-colored, or chalky stools. Medical sources confirm this happens because bilirubin, the yellow-brown substance produced during red blood cell breakdown, cannot be excreted properly when bile flow is blocked. The absence of bile in your intestines means this pigment never reaches your stool, leaving it with an abnormally pale appearance resembling clay or putty. Many people dismiss this symptom, attributing it to dietary changes or new medications. However, according to medical literature, pale stools that persist for several days represent a significant warning sign of biliary system problems. The liver releases bile salts into stool, giving it normal brown color. If your stools consistently appear lighter than normal, especially when accompanied by other digestive symptoms, this could indicate serious blockage requiring immediate medical evaluation. Next, symptom 3, dark urine despite adequate hydration. While we're discussing color changes, let's address what happens at the other end of your digestive system. You're drinking plenty of water, staying well hydrated throughout the day, yet your urine appears dark amber, tea-colored, or even brownish. This puzzling symptom occurs through a fascinating biological mechanism directly related to gallbladder dysfunction. When bile cannot flow properly through blocked gallbladder ducts, bilirubin accumulates in your bloodstream. According to research published in Stat Pearls, conjugated bilirubin becomes water-soluble and can be excreted by your kidneys. Your kidneys, working overtime to filter this excess bilirubin from your blood, excrete it through urine, causing the characteristic dark coloration. Medical literature describes this condition as bilirubinuria, and it represents an early sign of liver or biliary disease. This symptom often appears alongside pale stools, creating what doctors recognize as a complementary pattern. Patients may describe their urine as tea or cola-colored when jaundice occurs due to liver or biliary disease. What makes this particularly concerning is that many people assume dark urine simply means dehydration. If you're experiencing persistently dark urine despite adequate hydration, especially combined with pale stools, your gallbladder likely requires immediate medical attention. Next, symptom 4, chronic indigestion after fatty foods. Picture this common scenario. You enjoy a meal containing cheese, fried foods, butter, or rich sauces, and within an hour, you're experiencing uncomfortable bloating and indigestion that lasts for hours. While occasional indigestion affects everyone, persistent discomfort specifically triggered by fatty foods points directly toward gallbladder dysfunction. Your gallbladder's primary job involves storing and concentrating bile produced by your liver, then releasing it when you eat fatty foods to help digest fats. When gallbladder disease develops, this organ cannot contract effectively or release sufficient bile, leaving dietary fats poorly digested in your intestinal tract. Research shows that fatty food intolerance is a hallmark symptom of gallbladder disease. The symptoms typically include bloating, excessive gas, nausea, and uncomfortable fullness persisting long after meals. What distinguishes this from general indigestion is the clear pattern connecting symptoms specifically to fat intake. According to medical studies, patients with gallbladder dysfunction report typical symptoms including postprandial right upper quadrant pain, nausea, vomiting, and significant fatty food intolerance. If you've noticed yourself increasingly unable to tolerate foods you once enjoyed, particularly high-fat items, your gallbladder might be sending an important warning signal requiring professional evaluation. Next, symptom 5, unexplained nausea and vomiting. Nausea appearing seemingly without cause, especially after meals, represents another deceptive symptom of gallbladder disease. Many people attribute persistent nausea to food poisoning, stomach flu, stress, or anxiety, never considering their gallbladder as the source. When gallbladder inflammation occurs or stones block bile ducts, the resulting backup of bile and increased pressure triggers the nausea reflex through multiple mechanisms. Medical literature confirms that persistent nausea is a common presenting symptom in patients with acute gallbladder disease. The mechanism involves both physical obstruction and chemical signaling. When bile cannot flow properly, it irritates the gallbladder lining, triggering inflammatory signals that activate the brain's vomiting center. Additionally, inadequate fat digestion contributes to feelings of nausea as partially digested food sits heavily in your digestive tract. What makes this symptom particularly problematic is its non-specific nature that mimics many other conditions. People often try antacids, change their diet, or assume they have a sensitive stomach. The key distinguishing feature involves timing patterns. According to clinical observations, gallbladder-related nausea typically worsens within 1 to 2 hours after eating, particularly after consuming fatty or greasy foods. If you're experiencing recurring nausea episodes following this characteristic pattern, your gallbladder deserves thorough investigation. Next, symptom 6, chronic unexplained fatigue. Here's where gallbladder disease reveals its systemic effects extending beyond the digestive system. Profound, unexplained exhaustion that doesn't improve with adequate rest might seem completely unrelated to your gallbladder, yet this connection carries more significance than most people realize. When your gallbladder malfunctions, your entire digestive system operates less efficiently, leading to poor nutrient absorption and significant energy deficits. Furthermore, chronic inflammation from gallbladder disease triggers an immune response consuming considerable energy resources. The inadequate fat digestion particularly impacts absorption of fat-soluble vitamins A, D, E, and K, all essential for energy metabolism and cellular function. When your body cannot properly absorb these vital nutrients, fatigue naturally follows. Additionally, ongoing inflammation produces inflammatory cytokines that directly induce feelings of tiredness and malaise. Medical literature documents that patients with chronic cholecystitis often report persistent fatigue as a significant symptom. Many people visit multiple doctors seeking answers for their exhaustion, undergoing tests for thyroid problems, anemia, or depression, while their gallbladder silently struggles in the background. If you've experienced persistent tiredness that coincides with digestive symptoms, especially after meals, this combination strongly suggests your gallbladder might be contributing significantly to your energy problems. Next, symptom 7, jaundice and yellowing of skin. Now we arrive at one of the most visually striking symptoms, though it often develops so gradually that people don't immediately notice the change. Jaundice, the yellowing of skin and the whites of your eyes, occurs when bilirubin accumulates in your bloodstream due to blocked bile ducts. While dramatic, this symptom frequently develops slowly enough that you might not recognize it until someone else points it out. Medical literature confirms jaundice appears in approximately 1/4 to 1/3 of patients with gallbladder complications, particularly when stones block the common bile duct. The yellowing typically begins in the eyes, where the white sclera makes discoloration most apparent, then gradually spreads to facial skin and eventually throughout the body. This happens because normally, bile containing bilirubin flows from your liver through bile ducts into your intestines. When gallstones or inflammation block these ducts, bile backs up into your bloodstream, depositing yellow pigment throughout body tissues. Clinical research documents that cholecystitis can cause jaundice when gallstones prevent bile from clearing bilirubin from the body. Many people initially dismiss subtle yellowing as poor lighting or fatigue. However, medical sources emphasize that jaundice always indicates serious blockage in your biliary system, requiring immediate medical attention to prevent potential liver damage. Next, symptom 8, fever and chills. This symptom takes gallbladder disease into potentially dangerous territory, requiring urgent attention. When fever and chills accompany gallbladder symptoms, it signals that bacterial infection has developed, a condition called acute cholecystitis. Your gallbladder, when blocked by stones or severely inflamed, creates an environment where bacteria can multiply rapidly. As your immune system responds to this infection, fever develops along with characteristic chills and sweating episodes. Research studies document that fever occurs in a significant percentage of acute cholecystitis cases, though interestingly, many patients with even severe gallbladder disease may not present with fever. Clinical studies show that the fever typically ranges from low grade to quite high, often spiking during evening hours. What makes this particularly dangerous is that gallbladder infections can escalate rapidly, potentially leading to gangrene of the gallbladder or even rupture. According to medical literature, acute cholecystitis is characterized by right upper quadrant pain, fever, and leukocytosis associated with gallbladder inflammation. Many people initially treat these fevers with over-the-counter medications, assuming they have a viral infection. If you develop fever alongside any gallbladder symptoms, particularly upper abdominal pain, this represents a medical emergency requiring urgent intervention, often including intravenous antibiotics and possibly emergency surgery. Next, symptom 9, changes in bowel movements and diarrhea. Beyond the color changes discussed earlier, gallbladder disease significantly affects your bowel movement patterns and consistency in other ways. Many patients report chronic diarrhea, particularly after meals containing fat, as their body struggles to process dietary fats without adequate bile. When bile doesn't reach your intestines properly, fats remain undigested and unabsorbed, leading to fatty, loose stools that often float and appear greasy or oily. This condition, called steatorrhea, occurs because undigested fats move through your intestinal tract, pulling water with them and irritating the intestinal lining. Some patients experience the opposite problem, developing constipation as their overall digestive efficiency decreases. The unpredictability of bowel patterns, alternating between diarrhea and constipation, creates significant lifestyle disruption and discomfort. Medical literature documents that approximately 1/3 of patients experience diarrhea or altered bowel habits as part of their gallbladder disease presentation. Many people spend years managing these symptoms with dietary restrictions or medications for irritable bowel syndrome, never investigating their gallbladder as the root cause. If you've noticed your bowel patterns changing, particularly if changes correlate with eating fatty foods, comprehensive gallbladder evaluation becomes essential for identifying the underlying cause and restoring normal digestive function. Next, symptom 10. Heartburn and acid reflux. This symptom confuses many people and their doctors because heartburn seems clearly related to stomach acid, not the gallbladder. However, gallbladder dysfunction creates conditions that promote acid reflux through several interconnected mechanisms. When your gallbladder fails to release adequate bile, fats remain in your stomach longer than normal, delaying gastric emptying and increasing pressure on the lower esophageal sphincter, the valve between your stomach and esophagus. This increased pressure allows stomach acid to flow backward into your esophagus, causing the burning sensation we recognize as heartburn. Medical research documents that a significant percentage of patients with gallbladder disease experience reflux symptoms. Additionally, the inflammation associated with gallbladder problems can affect the nearby stomach and duodenum, altering their normal motility patterns and contributing to reflux. Many people treat recurring heartburn with antacids or proton pump inhibitors, achieving temporary relief without addressing the underlying gallbladder issue. The distinguishing feature of gallbladder-related reflux involves its association with fatty meals and resistance to standard heartburn treatments. Clinical observations show that symptoms include heartburn, flatulence, and indigestion in patients with biliary dysfunction. If you've been managing chronic heartburn that doesn't fully respond to acid-suppressing medications, especially worsening after high-fat meals, your gallbladder might be the hidden cause. Next, symptom 11. Sudden, severe upper abdominal pain. Here's the symptom most people finally recognize as serious, yet many don't immediately connect it to gallbladder disease. A gallbladder attack, medically termed biliary colic, produces intense, sudden pain in the upper right abdomen that can literally take your breath away. This pain occurs when a gallstone temporarily blocks the cystic duct, causing the gallbladder to contract forcefully against the obstruction. According to research, the pain typically begins suddenly, reaches maximum intensity within 15 minutes, and can last from 30 minutes to several hours. Patients describe it as cramping, stabbing, or squeezing pressure that may radiate to the back, between shoulder blades, or right shoulder. The pain often occurs after eating a large or fatty meal, typically starting 1 to 2 hours post-meal when the gallbladder attempts to contract and release bile. Clinical literature confirms that gallstone disease typically presents with right upper quadrant pain, often accompanied by nausea and vomiting. What makes this particularly frightening is the intensity level. Some patients report pain severe enough to cause profuse sweating, nausea, and vomiting. Many people experiencing their first gallbladder attack fear they're having a heart attack. The pain may subside when the stone shifts, leading some to delay seeking care, not realizing they're at risk for repeated attacks and serious complications. Next, symptom 12, loss of appetite and weight changes. This subtle symptom often develops so gradually that people barely notice until significant unintentional weight loss has occurred. When your gallbladder malfunctions, eating becomes less enjoyable as you begin associating meals with discomfort, pain, and nausea. The body learns this connection quickly, triggering appetite suppression as a protective mechanism to avoid the pain and digestive upset that follow eating. The fat malabsorption we discussed earlier means that even when you do eat, your body cannot extract all available nutrition from food. Fat-soluble vitamins especially become deficient, potentially leading to problems beyond weight loss, including bone weakness, vision changes, and immune system dysfunction. Additionally, the chronic inflammation associated with gallbladder disease consumes extra calories, further contributing to weight loss. Many people initially welcome weight loss, not recognizing it as a disease symptom. However, this isn't healthy weight loss from proper nutrition and exercise, but rather malnutrition resulting from inadequate calorie intake and poor nutrient absorption. Clinical observations document that patients with cholecystitis often experience loss of appetite and may avoid eating due to pain. If you've noticed decreasing appetite accompanied by digestive symptoms, or if people comment that you've lost significant weight without intentionally trying, don't dismiss this until you've ruled out gallbladder disease. Next, symptom 13, itchy skin without rash. Here's one of the strangest symptoms that few people connect to gallbladder problems. Persistent, unexplained itching all over your body without any visible rash or skin changes can indicate bile salt accumulation in your bloodstream. When bile ducts become blocked by gallstones or inflammation, bile salts that should be excreted into your intestines instead accumulate in your blood and deposit in your skin, triggering intense itching sensations. Medical literature confirms that pruritus, the medical term for itching, affects a significant percentage of patients with obstructive biliary disease. The itching can be maddening, often worsening at night and significantly affecting sleep quality. Many patients scratch enough to cause secondary skin damage from the scratching itself, yet the original cause isn't a skin condition at all. People try various lotions, antihistamines, and dermatology treatments without relief because they're treating the symptom rather than the underlying bile duct obstruction. Research shows that cholestatic pruritus occurs in patients when bile flow is impaired, and it can be quite severe. The itching typically accompanies other signs of bile duct blockage, particularly jaundice and dark urine. If you've developed unexplained, persistent itching that doesn't respond to typical skin treatments, especially if you've noticed any yellowing of your eyes or skin, this combination strongly suggests your gallbladder and bile ducts need immediate medical evaluation. We've explored 13 surprising symptoms that your gallbladder might be in distress, from shoulder pain to unexplained itching and many warning signs that seem completely unrelated to this crucial digestive organ. Understanding these symptoms empowers you to recognize potential gallbladder problems early before they progress to serious complications. Remember, gallbladder disease affects millions of people worldwide, and early detection significantly improves outcomes. If you're experiencing several of these symptoms, especially in combination, don't wait. Schedule an appointment with your healthcare provider for thorough evaluation, which might include blood tests or ultrasound imaging to assess your gallbladder function. If you found this information valuable and it helped you understand gallbladder symptoms better, please type "helpful" in the comments below. Your feedback genuinely motivates us to create more evidence-based health content that can make a real difference. If you think this could benefit someone experiencing these mysterious symptoms, please share this video with them. Don't forget to hit the like button and subscribe to our channel for more health insights that could change your life. Thank you for watching, stay healthy and informed, and we'll see you in the next video.